considered my scene safety and got standard precautions on, so I've got my gloves on. I'm going to explain the procedure to my patient, so I'm just going to be performing a neurological assessment on you today. Is that okay with you?
It's okay.
Yep, awesome. So I've gained their consent and I'm just going to make sure that they're in a position of comfort. Are you comfortable lying there like that?
Yeah.
Yep. Okay, so the patient is alert, so that's an A in the AVPU. Are you able to just give me a smile? Awesome, and can you lift both your arms for me? Cool, and can you count to 10 for me?
10. Backwards or forward? Forward, 1, 2, 4.
Okay, so the patient has some slurred speech. So the next thing I'm going to go through is my AEIOU tips. So this is for whether a patient has a altered mental status, so looking for things like alcohol, acidosis, epilepsy, insulin, overdose or underdose, uremia, trauma, infarction, ischemia, or infection, psychosis and stroke or seizure. And then I'm going to go through my GCS scale. So the patient has their eyes open spontaneously, so that's a 4. 3 would be opens their eyes to voice, 2 would be opens their eyes to pain, and 1 would be no eye movement. And then verbal would be a 5 would be oriented, 4 confused, 3 inappropriate words, 2 incomprehensible sounds, or 1 no response. So at the moment they have incomprehensible sounds, so that would be a 2. And then I'm looking at their motor response as well. So 6 would be obeys commands, 5 would be localizes to pain, 4 withdraws from pain, 3 flexion, 2 extension, or 1 no motor response. So I'm just going to test that by doing a trap squeeze, and they're withdrawing from pain. So that is a 4. So they have a total GCS of 7. The next thing I'm going to do is just assess their pupils. So going from lateral to medial. And their pupils are about 2 to 3 millimeters and equal and reactive to light. So now I'm just going to explain my findings to the patient. So we do have a few concerns about your neurological status at the moment. We would like to transport you to hospital just to do some further investigation. Is that okay with you?
That's good.
Cool, so we'll take you up there now. Done?
It's not stopping me.